Hi friends, April 2nd is World Autism Awareness Day, approved by United Nations to recognize and celebrate the rights of persons with autism. This day encourages the UN member states to take measures to raise awareness about people with autistic spectrum disorders, including autism and Asperger's syndrome, throughout the world. Autism is a serious developmental disorder that impairs the ability to communicate and interact. Autism is one of the autistic spectrum disorder or ASD. Autistic spectrum disorder or ASD is a broad term used to describe a group of neurodevelopmental disorders. ASD impacts the nervous system and affects the overall cognitive, emotional, social, and physical health of the affected individual. Now, what are the symptoms of ASD? These disorders are characterized by problems with communication, social interaction, and behavior. People with ASD often demonstrate restricted, repetitive, and stereotyped interests or patterns of behavior. ASD is found in individuals around the world, regardless of race, culture, or economic background. As per studies, autism occurs more often in boys than in girls, with a 4:1 male to female ratio. Nearly 1 in 59 children all over the world are affected by ASD. There are indications that instances of ASD are on the rise. Some attribute this increase to environmental factors. However, experts debate whether there is an actual increase in number of cases or just more frequent diagnosis. ASD is of different types. Let's see its symptoms. When do we realize that a child is autistic? The symptoms of autism typically become clearly evident during early childhood between 12 and 24 months of age, that is between first and second years of age. However, symptoms may also appear earlier or later. How does autism affect kids? Children with autism may not reach the same developmental milestones as their peers or may demonstrate loss of social or language skills previously developed. ASD affects every person differently. They are different in three main areas. 1. Focus and attention. 2. Reaction to sensory input. 3. Thinking and processing. Early symptoms may include a marked delay in language development or social development. The main symptoms include problems with communication and social interaction. That is, the child may have difficulties in sharing emotions, sharing interests, or maintaining a back and forth conversation. The child may have issues with non-verbal communication such as trouble in maintaining eye contact or reading body language. He or she may have difficulties in developing and maintaining relationships. Another important symptom is restricted or repetitive patterns of behavior or activities. These include repetitive movements or motions or speech patterns, rigid adherence to specific behaviors or routines, an increase or decrease in sensitivity to specific sensory information from the surroundings, such as negative reaction to a specific sound, fixated interest or preoccupations. Now let's see what causes autism. The exact cause is unknown. The latest researchers say that there is no single cause. Some of the suspected risk factors include having an immediate family member with autism, genetic mutations, being born to older parents, low birth weight, metabolic imbalances, exposure to heavy metals, a history of viral infections, or fetal exposure to some of the medications. According to National Institute of Neurological Disorders and Stroke, that is NINDS, both genetic and environmental factors determine whether a person develops this disease. An ASD diagnosis involves several different screenings, genetic tests, and behavioral evaluation. Screening is to be done at 18 and 24 months, that is at 1.5 to 2 years. Screening can help with early identification of children who could have ASD. These children may benefit from early diagnosis and intervention. Now let's go to the treatment. First of all, autism cannot be cured completely, but therapies and other treatment considerations can help people feel better or alleviate their symptoms. Treatment approaches include therapies such as behavioral therapy, play therapy, occupational therapy, physical therapy, and speech therapy. However, treatment results will vary. Alternative treatments include high-dose vitamins, hyperbaric oxygen therapy, melatonin to address sleep issues. It is a lifelong condition. It cannot be cured. It is true that they are different, and being different is not always easy. They can be bullied, they can be left out, they can be ignored, they can be picked last, or they can be asked to leave out because they are not a good fit. They cannot be like everyone, even if they wanted to. But we can make a difference. We can talk to them, interact with them, Let them join us. Let's not expect them to be normal. Let them be them only. Let's not force them to fit in. Being diagnosed with autism doesn't mean one cannot accomplish amazing things. Though learning to manage symptoms and work towards specific goals take time and practice, one thing is certain. Kids with ASD can achieve success in their fields of interest. Let's see some of these ASD success stories. The first one is Dan Aykroyd. He is a Canadian actor, comedian, writer, producer, and musician. He was expelled from 2 schools when he was a child. In an interview, Aykroyd shared that one of his symptoms of ASD was his obsession with ghosts and law enforcement. Aykroyd goes on to credit this symptom of ASD as a catalyst for his famous movie Ghostbusters. The second one is Susan Boyle, Britain's singing sensation, who was diagnosed with Asperger's syndrome. Even though we were not sure, some autism experts say that even the famous scientist Albert Einstein had showed many signs of Asperger's syndrome. Actress Daryl Hannah was diagnosed with autism as a child. Temple Grandin, a professor of animal science at Colorado State University and author of several books, didn't begin speaking until she was 4 years old because of this disease. This year, World Autism Awareness Day observance takes place in the midst of a public health crisis, COVID-19, that places autistic persons at disproportionate risk. As per United Nations, persons with autism have the right to self-determination, independence, and autonomy, as well as the right to education and employment on an equal basis with others. Universal human rights, including the rights of persons with disabilities, must not be infringed upon in the time of a pandemic. It is the responsibility of the governments to ensure this. We all have a role to play in ensuring that the needs of people who are disproportionately impacted by COVID-19, especially persons with ASD, are met during this difficult period. On World Autism Awareness Day, let's stand together, support each other, and show solidarity with persons with autism. Thank you.